Hi guys, I'm Ava, and thank you for joining us today for the Girl Scout Senior Women's Health Zoom, touching on all 5 steps of the Girl Scout Senior Women's Health Badge. Let's start with the Girl Scout Promise and Law. Please raise your right hand. On my honor, I will try to serve God and my country, to help people at all times, and to live by the Girl Scout. Okay, now we're going to say the law. I will do my best, honest and fair, friendly and helpful, considerate and caring, courageous and strong, and responsible for what I say and do, and to respect myself and others, respect authorities, use resources wisely, make the world a better, and be a sister to every Girl Scout. Okay, good job. It is my pleasure to introduce you this afternoon, Miss Emily Pope. Miss Emily is a nurse practitioner who specializes in pediatrics. The pediatric age range is defined from 0 to 18, which is basically birth to 18. Miss Pope earned her Masters of Science in Nursing at Vanderbilt University in Nashville, Tennessee, before moving to California and working with St. Joseph Health Medical Group in Santa Rosa. Thank you, Miss Emily, for joining us.
Hi, thank you everyone for joining us today. We're going to talk about my favorite topics, which is pediatric health. So I was born in Kansas City, Missouri, and I moved to California when I was 5 years old with my family. So I really remember growing up in the West Coast. I originally wanted to be a teacher, and then when I was 11 years old, I became very sick right before I started 5th grade. I started having a lot of GI symptoms and kept going to my doctor. And long story short, I was hospitalized for several months, and at UC Davis in Sacramento, and I was diagnosed with a disease called Crohn's disease. And so through that experience, I live with Crohn's now, and I take lots of medication for it. But through that experience, I was introduced to the healthcare industry, specifically pediatric nurses. So being a child who spent a lot of time in a hospital, my nurses were my advocates. They were the people who spoke for me, who comforted me, who explained things to me. And I just saw myself someday when I was 11 years old. I said, I'm going to be a pediatric nurse when I grow up. I want to work with kids who are sick. I want to help them. I want to be there for them when I can. And that's what I did. So I ended up going to college in Nashville, Tennessee, at Vanderbilt University, because I'd grown up in California and I wanted to try something new, and I decided to research best nursing programs, and Vanderbilt was in the top 10, and that's where I got in. And then I stayed there for undergrad. I also have a degree in child development and psychology, which is very helpful because I use that every day that I work. And then I started working as a pediatric nurse at Vanderbilt Children's Hospital, and I was able to, through my job, go to graduate school and get a master's degree in nursing to become a nurse practitioner while I was working, and I had a tuition benefit, so I decided to take advantage of that when I was young. So I ended up graduating with my master's when I was 25, and I continued working as a nurse, and then I also worked as a nurse practitioner. Then I was also hired on at Vanderbilt Nursing School as a nursing faculty, so I taught nursing school for several years. And that's also where I met my husband. He was a resident in anesthesia at the time, so he's an anesthesiologist, and now he actually specializes in chronic pain management. So he is a surgeon now and operates on patients who are dealing with long-time chronic pain. So we both work in medicine, which is very helpful because we understand what the other one cares about and does, and the long hours and the stress. And then now we found our way back out to California because this is, really where I feel like is home for us. And I work in Santa Rosa at a pediatric practice that's been around since the 1970s. It's a wonderful place to work. I thankfully work part-time because I have 3 children at home. And so at the moment, I don't work in the hospital. I work in the clinic. So I do well-child checkups, sports physicals, newborn exams, anything related to sick. And then these days, anything related to COVID. So I also work in our COVID clinic, and I do the swabbing for COVID. So my favorite thing about nursing is how flexible it is and how I can work in the hospital, I can work in the clinic, I can work in a school, I can work day shift, night shift, I can work it around my child's schedule. It also is the most rewarding profession. I get these really sacred experiences with my patients and their families, and I get to know them well and interact with them even outside of my office in the community, and it's just a wonderful job to have. So I highly encourage nursing school and nurse practitioner school if anyone is interested in it. So let's see, we're going to talk about why health is important. So in my opinion, health is crucial to life. It is taking care of our bodies. We only get one body. We don't get another one. So we get this body and we need to take care of every part of it. Will we make mistakes along the way? Yes, but our focus needs to be educate ourselves about how I take care of my body and then implement that in your everyday life as best as you can. Some days are easier than others. So that's why health is important, because we want to live a long, beautiful life. And in order to do that, what we do now as young teenagers, as young adults, and myself is really going to impact how long we live and what our quality of life looks like later on. You know, I'm seeing my aging parents and they're wanting to travel and do lots of things. And thankfully, they have really implemented some good strategies in their youth to be able to live a long life, travel, be active, play with their grandkids. It's amazing to see. So women are different than men, just purely based on the fact that a lot of our body parts are different. So some are similar, but really how we function as women is different. A lot of it is influenced by our hormones too. So, and I'll talk a little bit about that. But women do face diseases and health issues differently than men based on our makeup. And so some of those, I'm going to kind of list the top 10 ones that women really struggle with in the United States. That's breast cancer, cervical cancer, reproductive problems, maternal child health. So when you think about becoming pregnant and going through pregnancy and then childbirth, there are health issues surrounding that. STDs, STIs, HIV, violence against women is a big issue. Also mental health, autoimmune diseases, GI issues or gastrointestinal issues, and also heart attacks. So for women, these are really the main issues, and we actually have a higher risk of these issues than men do, particularly heart attacks and strokes, autoimmune diseases, GI issues, violence against women, also breast cancer and cervical cancer, because that's just the makeup of our bodies. So we're going to talk about how to prevent some of those things or how to keep an eye on it. So if you do have a problem, you can go seek healthcare from your medical provider. So really in difference in how we face issues in the US and how women and young girls face these issues in other countries. You know, some things are going to be the same, but we actually, one of the things I want to highlight is we have now a much lower rate of cervical cancer. And one of those reasons why is because of the HPV vaccine. So in the US, in comparison to third world countries, we have access to vaccination, and we have access to healthcare more readily. We have access to better screening tools. So things that can help us detect a problem should we have symptoms, or even rule out a problem, because just because you might have symptoms that seem like it could be a chronic disease or something really scary, everything might turn out fine. So we have the ability to test for something. We also have the ability to prevent, because through vaccination, and we also just have access to better nutrition and proper education into how we can best take care of our bodies. So one of the first things, talking about prevention and vaccination, is going to be the flu vaccine. So the flu vaccine is going to be a really big topic this year with COVID. So I'm encouraging all my patients right now, I'm talking about the flu shot. When your office gets the flu shot in, when Walgreens, CVS, wherever your parents or you've gone to get a flu shot, go get it this fall. So I believe in the flu shot. It really does work. I myself, as a healthcare provider, I have to get one every year in order to be at work. And I telling you, when flu season comes and I'm going into an exam room and it's a closed exam room and there's a kid and a parent with a fever and they're coughing, I'm very thankful that I got that flu vaccine, because I feel confident that I'm helping myself. Is the flu vaccine always effective? No, it's not. So what's interesting about the flu vaccine is they take what's circulating in Asia, other parts of the world, what flu strains are circulating, and then the manufacturers and the amazing researchers are going to take the 4 prevalent strands and create a vaccine to try to prevent that. So you have to get a vaccine for the flu every year, because the flu virus is always changing. There's so many different strands of it. So every year that vaccine is going to be different. So you don't get it one and done like some other vaccines. It's going to be an annual vaccine. And every year, what I do think is amazing about vaccines is that it kind of, your body is getting introduced to an organism. It's making a memory of that organism, a fingerprint, and then your body remembers it. Let's say when I walk into that exam room or I walk into that classroom and my friend or my neighbor or my patient has the flu and is actively shedding that virus through their cough, through their nose, I am protected. My body says, oh, I know you. I know that viral organism. I've already made a memory of you. I'm going to stop the replication of it, get rid of it. Maybe you might have some minor symptoms of the flu, even if you got the vaccine, but it really does help prevent the complications that we know can happen with people from the flu vaccine, or from the influenza itself. Even healthy individuals who have no underlying problems can have serious complications from the flu. So I really encourage you this fall, talk to your mom and dad about getting the flu vaccine. So moving on to things that you should talk to your doctor about, or your nurse practitioner, when you go in for your well-child checkups. And this also goes into your adulthood when you start to do physicals with an adult healthcare provider. So I get commonly asked about, what blood tests should I do? What should I be looking for? So for the most part, we can do a basic panel of blood work. I really focus it on, do you have any symptoms? What are you experiencing right now? So for a lot of women, one of the biggest complaints I hear from teenagers is, I'm tired. I have fatigue. Every day I wake up, I'm sleepy. I have trouble staying asleep at night. I have trouble staying awake during the day. And so could there be something wrong with my body? And absolutely there could be. And one of the great ways to look at that is to do some basic blood work. Usually we do a CBC, it's called a complete blood count. I might also look at some other lab work that evaluates for anemia, like a ferritin or a tick count, iron capacity. Also might check the thyroid. So there's a couple different lab works that we can order to test the thyroid. Is the thyroid acting appropriately? Is it overacting? Is it underacting? And a lot of teens that I see, their moms or their grandmas have had thyroid disease. So we want to make sure that that thyroid is working at its full capacity like it should be. Also vitamin D. So this is probably one of the things I encourage the most for my teenagers and young women to have checked, is a vitamin D level. So of all the nutrients that I see women deficient in, it's vitamin D. And why? Because a lot of teenage girls stop drinking milk. It's very common. So, you drink milk as a child and you kind of transition into adulthood and it just maybe doesn't taste good. It's not something you want anymore. You're drinking water, you're drinking, sparkling water, different things. You just don't get that glass of milk anymore. Well, the effect that it has on your body is that you might have a lower intake of vitamin D. There are other sources of food that have vitamin D, like spinach, but really you have to eat a lot of spinach to maintain an adequate level of vitamin D. So if you don't feel like you have a good source of vitamin D in your diet, maybe you don't drink milk, don't eat yogurt, don't have cheese, you might want to consider having a multivitamin and a vitamin that has calcium and vitamin D. So vitamin D is something that we need to have in our diet. Also, it then is synthesized when we are out in the sun too. So we'll talk about sun exposure in a minute. A little bit of sun exposure is excellent for your health, about 15 minutes. But when we're out laying out for 2 hours, we're outside by the pool, that's a different story, and that's going to be harmful for our skin. But vitamin D and sun go together. So talking about calcium, that's a really important nutrient to have in your diet, and that's something that you might also want to supplement if you don't feel like you have a good source of calcium, which we can get in milk. So the reasons why calcium are important, and it's actually important before you start that first menstrual cycle, and then while you're going through that big growth spurt, and then even after. So right now, when you're young, your bones are mineralizing. So they are doing their job that's going to set you up for lifelong good bone health. So it's important to take calcium, have calcium in your diet when you're young, especially when you're going through that rapid growth spurt, not when you're my age, not when you're 50, not when you're 60 or older. You really can't go back in time. So this is that other piece about nutrition that's really important. So getting your vitamin D, your calcium, if you don't see that in your diet. So we can also check those levels when you come to your healthcare provider, because those are, if the levels get low enough, can cause symptoms that do affect your health, affect how you feel on a daily basis. So other things like cholesterol, screening for type 2 diabetes, these are things that I used to routinely do at age 12, and we actually don't do that anymore unless you're at risk. So reasons why I might order those is if you have a family history of high cholesterol, type 2 diabetes, and also if on my growth chart, if you have any signs that your height and your weight are out of proportion. So if we see that, your growth is kind of stabilized, but your weight is still going up, maybe you don't have the best nutrition, maybe you don't have the best access to food, I'm going to start looking at some of those labs that lead to type 2 diabetes, because I do start to see it in young kids as young as 12. So, and that's where you're starting to change how you produce insulin over time. So it's very important to have healthy nutrition, healthy lifestyle, including exercise, to try to prevent things like high cholesterol, type 2 diabetes. Interesting fact, kind of a side note about COVID. COVID cases that are seeming to have patients, why do patients do okay and then why do some others not do well? One of the biggest factors with that is obesity and type 2 diabetes. So these are really important things to try to prevent, and you work on it when you're young. So right now you're establishing, how do you exercise? What kind of foods do you eat? How do you eat? And so really, things now will make a difference as you get older. Now, did I eat Taco Bell at least a couple times a week when I was 16 years old? Absolutely. I love Taco Bell. It's my favorite. I do know now that it is not the best thing for my body. And I do feel like we have much better information about food and the quality of food and our access to food. So with my own children, I really, really encourage healthy nutrition. So I'm going to talk briefly more about nutrition, since that's kind of where we're headed right now. But with nutrition, my biggest thing is I don't really believe in diets. I don't like the word diet. I never tell somebody to start a diet. I would love for you to educate yourself about nutrition, about food, what food groups are out there, what matters, what food groups are important, and look at what you eat at each meal and how you can make simple changes. All of us have different taste buds. I see this in infants. I talk to moms about, pureed food when they're starting out. Some love veggies, some love fruits, some don't like anything. We are all different. Do we like salty foods? Do we like sweet foods? Yes, we will vary person to person. But one of the biggest things that I talk about is having this plate, and half of the plate should be fruits and vegetables 3 times a day at 3 meals. So vegetables even being the biggest part of the plate. So why? Because they have the biggest nutrients in them. They have things that fight off cancer and autoimmune diseases, which we know as women we're more susceptible to. So getting those fruits and vegetables are super important. Things like broccoli and cauliflower and asparagus and zucchini. And the more color it has, the more nutrients. So sweet potatoes, that's another great one. So, and we might not like it at first too. If you're not somebody who's used to eating vegetables, this doesn't taste very good. But your body needs, your brain needs about 8 times to say, okay, it didn't kill me. I'm okay. I don't really like it, but I'm gonna keep eating it. So just keep trying, start out, I set goals with my patients, 3 bites of broccoli at dinner, pick a vegetable. Next night, pick a different one, 3 bites. Next week, do 4 bites, do 5. Do something that just kind of helps you incorporate that food into your diet more. The other half of the plate is whole grains and then is protein. So protein is really important. It lasts with us longer than any other food group. Things like chicken, lean ground beef, fish, it really can help us make it through our day. So I know that when I don't have protein, and protein can also come as tofu too. It doesn't have to be from an animal product. But when I don't have protein at my lunch, I know that I am not going to feel that great come 4 o'clock when I'm still seeing patients. So because that protein takes longer for my body to digest, and it really does keep me going. The other part is the whole grains. Grains are important, and why we say whole is because it has more fiber in it. And fiber leads to better digestive health. I talk about constipation at least 10 times a week with my patients. It's one of the most common things that I see with digestive health and health. So it's really important, and I talk about poop all the time, so here we go. But it's really important to have a stool, a bowel movement every day that's soft and doesn't hurt when it comes out. And how you can do that by 2 things: more fiber in your diet through whole grains, vegetables, and fruit, but fruits aren't actually not the best for it, and water. So those are things that are really important to kind of keep things moving and really help with digestive health, because that's also leading to that digestive health issues later in life. Chronic constipation for years and years and years can lead to colon rectal cancer as an adult. The other piece of that puzzle is dairy. It just needs to be some source of calcium, vitamin D. I actually have a dairy allergy. I drink almond milk, that's fine. But I also do take a supplement with calcium and vitamin D because I know I'm probably not getting enough since I'm not a big milk drinker. The other thing, if you do take a supplement, please avoid gummies. Gummies are I'm a big believer in avoidance of gummies, all things gummies, but that little sticky gummy candy or vitamin gets stuck between your teeth, and it's one of the leading causes of decay. Dentists, hopefully your dentist is telling you avoid gummy things, and that's often through vitamins. So I'd rather you take a chewable, a Flintstone, or swallow a pill. So that leads us to water. Water is so important. I know you guys did a fitness badge, and the fitness trainer talked about water, the importance of water. Water is really important for our bodies. We are actually almost half of our body is made up of water, and we need to replenish throughout the day, not at night. We need to do it in staggered amounts throughout the day. So start out drinking some water, continuing that with each meal. Stay hydrated. That helps our skin. Water actually is one of the things that can really help with acne in teen years. And so another thing I talk about a lot is acne. It's very normal. It's very common. I would say sometimes if you don't have acne as a teenager, you're lucky. Most teenagers have it. Different severities, different types. So I'm going to give you a couple tips that you can easily do over the counter. You don't even have to get a prescription of medication for. But the first thing to start with is cleansing your face every day with what's called a non-comedogenic, which is a non-acne producing cleanser. You want to wash your face at the end of the day, get all that dirt, oil, grease off. You want to try to avoid touching your face. I do this a lot sometimes, or I kind of, like when I'm stressed, I touch my forehead. Try to keep your fingers away from your face. So at night, cleanse your face with a gentle cleanser like Cetaphil is a great product. And then some products that are good that you can find over the counter are something called benzoyl peroxide It is actually has an element of bleach in it, so it can stain your pillowcase or your clothes. But I recommend 5% wash to the face, and if you're struggling with chest or back knee, the 10%. So you can do that in the shower. The other thing I recommend is Differin gel. So this used to be a prescription. It's now gone to over the counter. It's spelled Differin, Differin gel, and it's a retinol product. It turns the skin over the fat on the skin faster, but you do, kind of spot treat the problem areas. Maybe the chin, the nose is really common. So you want to just spot that, treat that face after about 15 minutes after you've washed your face with that gentle wash. Let your skin dry for 15 minutes, then apply that Differin gel, then go to bed. If these things aren't working, you're unhappy with your skin, come see your healthcare provider. There are step-up treatments for acne, and then we can also refer you to a dermatologist. But your nutrition and staying hydrated do have an impact on your skin. So sugar is one thing that is out there. It's thought to be a big influencer on acne. It's not proven, but it does contribute to acne flares. Also, staying hydrated helps improve. So for the most part, if eating healthy, getting those vegetables, especially getting those antioxidants in your diet through things like vegetables, will really help your skin overall. So talking about skin, let's talk about sun damage and sun exposure. So I've had a lot of sun exposure in my life. I used to play competitive golf. I started playing competitive golf when I was 15 years old and continued that into college. So I was out in the sun a lot, and I didn't like to put sunscreen on. My mom, honestly, she loved to get tan, and she didn't put sunscreen on very, very well. And as a kid, I don't feel like I had a habit of putting sunscreen on. But I'm seeing now, I'm in my 40s, I'm seeing now the effect of not protecting my skin when I was young. And the biggest thing is my hands. So I used to hold my golf club, like this. So I have a lot of sun damage on my hands. And I wish I knew what I know now. So when I was young, I wanted to be tan. I find now that there's so many great products on the market. There's ways that you can, do some natural lotions that can help tint your skin. That is much safer than going to a tanning salon or being out in the sun without some form of SPF. So SPF is going to protect your skin from those harmful rays. Now, if you go out for 5 minutes, 10 minutes, that's okay. If you are going to be out driving your car on a long road trip, you're going to be out camping, you're going to be at the pool, you're just going to be having a picnic outside, social distancing with your friends, you need to wear your sunscreen. So we have different types of skin throughout our bodies. The areas that are most prone to sun damage are our face, our hands, wherever our skin is thinner. Our hands, our chest right here. Our legs are different though, but also equally as important. So over time, when we don't protect our skin, we get lots of, these moles throughout, and I have lots on my arm too. So get freckles, you're gonna get more moles, and that's just a sign that your body is getting exposed to sun damage and those skin cells are changing. So I really encourage you to wear sunscreen with SPF in it. So at minimum 15, and you wanna get makeup or lotion or moisturizer that has sunscreen in it too. So you're always putting it on your face, and then I keep it in my car. I keep a little tube of Sun Bum in my purse, so when I know I'm out and for a long time, I put it on my hands. It's really important now because it's hard to see. You guys have, I'm sure, beautiful skin, and it's youthful and it has lots of elasticity in it, but over time you will see those effects of how you treat your skin now as a young adult. Moving on to kind of makeup from there. So, makeup is interesting. I didn't wear makeup until I was about 18 years old, and I went to college and I thought, well, maybe I should start wearing makeup. And I have different views about makeup. I mean, I really feel like less is more. So there's a lot of makeup I see on teenagers, a lot of heavy eyeshadow, a lot of heavy moisturizer or a foundation. And a lot of these products do contribute to acne. So if you're struggling with acne, I really encourage you to look at your makeup. There are non-comedogenic type makeup out there. You can just Google that and look at the best products. So really things that you want to stick with are moisturizers that have an SPF in it. You know, maybe something if you want that tan to your face, but you're gonna be careful and not have sun damage and sun exposure. There's tinted makeup products that you can do. If you are wearing a lot of eye makeup, you're going to want to take that off every day. Every day. I do see quite frequently eye infections from makeup. You want to wash your brushes. You want to keep everything clean, because if we use that same brush or that same sponge every day for months on end, there is bacteria in that. There's dead skin cells. So keep them clean, wash them. That also leads me to talk about things like loofahs. If you're spending a lot, you have a lot of acne or problems on your body with acne, are you using a loofah or something in the shower that's sitting in there wet all the time, never really getting clean, never really getting dry? That could actually be what's contributing to your acne. So if you're using that scrub brush or loofah, you're probably breaking a little bit of the skin. We all have bacteria on the outside of our skin. It's normal. It's very helpful. We have staph and strep, different strands, but we don't want that to go into our skin. So when we create those little broken skin excoriations in our back from the loofah, you can actually introduce that bacteria and get acne from it. So try to look at your products, look at what you're using. Are you keeping everything clean? My motto is always less is more. I truly believe you want to show people your natural face, who you are. You don't need to cover it up with makeup. So talked about a little bit about tanning. Just avoid it. That is the biggest tip. Really going to the tanning salon is harmful to your skin. And like I said, later in life, that can be a problem. So also talking about a little bit about diets and nutrition, just what I want to touch on is when I talk to my kiddos who want to know about, how can I lose weight or how can I improve my nutrition, I show them that chart, that plate with the half fruits and vegetables, the whole grains, and the protein. And I say, okay, I want you to eat 3 meals a day. I really do believe that 3 meals a day is important. When you wake up in the morning, you need to feed your brain. All of us are working or doing distance learning. We need to put food in our body. I do see that kids who would avoid breakfast do actually have weight gain, because you're teaching your body, you don't know when you're going to get your next meal. You kind of go into this fasting mode. And if you go long periods without eating, and then let's say you get really, really, really hungry and you go to your pantry and you eat a large bag of chips and you think, okay, it's not that bad. I went a long period of time without eating. Your body is going to hold on to all of that food, all those calories, because it doesn't know when it's going to get its next meal. So eating regularly throughout the day, maybe even a snack or two in between that's healthy, like cheese and crackers, peanut butter and apples, really helps your metabolism get into a good groove to where you're actually maintaining your weight. Going long periods of time without eating can actually encourage weight, because your body does hold on to what it eats. When you are hungry, my biggest encourager is try to avoid the pantry. Go to your fridge, go to the leftovers that mom or dad made you. You want to get fruits, veggies, you want to get carrots and ranch. You want to get something that actually is going to really fill you up and get you to that next meal, instead of something that might make your blood sugar go up and then go back down really quickly, which are snacky type foods. So they really don't have a lot of nutrients in them. They have a lot of calories in them. Is it okay to eat pretzels? Or today I had a couple Cheetos because my kids were eating it. Absolutely, absolutely. But I made sure I ate my breakfast, my lunch, and my dinner with my healthy food group. So, and that's why less is more. So our goal in pediatrics, when I talk about dessert too, is try to pick 2 nights of the week that you want to have dessert. Okay, try to stick with that. Does dessert need to be every day? No. But do you need to eliminate dessert to be healthy? No. Absolutely not, because sometimes when we do try to eliminate things that we think are bad, our body craves them more, And when we do have the opportunity, we might do something called binge eating, where we eat a lot of that unhealthy food in one sitting. So just try to stick with your routine, 3 meals a day, that healthy plate with half fruits and vegetables. Keep it regular. Drink water throughout the day. I promise that will get you on the right track. And then exercise is the other piece of that puzzle for good heart health, for mental health, for keeping, really every system in our body healthy. Exercise should be at least 30 minutes at a time, something that gets your heart rate up. So if you're not really feeling it, you're not really moving your body, you're not really tired after it, you didn't do enough. Try more. There's lots of things online right now. You can do YouTube dancing. You don't have to have a gym. You can do YouTube dancing. There's Pilates on YouTube. There's different programs you can subscribe to. So it's really helpful to try to pick 3 days a week. That's a goal for 30 minutes, something that gets your heart rate up. That's the other half of that staying healthy piece. So I'm going to move on to some what we would call risky behavior. So I always talk to my teens and young adults about risky behavior. One of my biggest things is vaping. I see a lot of vaping starting in 7th and 8th grade. Vaping is really bad for you. I cannot say that enough. There are so many myths about vaping, and there's a lot of thoughts that, oh, it's okay because I'm not smoking a cigarette and it's fruity. I actually had a patient who tell me that it was one of her fruits for the day. And there's a lot of myths out there. So I want to say it really clearly, vaping is really bad for you. So it has nicotine in it. Also, anything that you heat up and you inhale is bad for your lungs. It doesn't matter if it's marijuana, if it's tobacco from a cigarette, if it's nicotine in a vaping pen, you are heating up a product which creates what's called carcinogen, and you are inhaling that into your lungs, and that leads to lung damage and then potentially lung cancer later in life. Really bad stuff. So vaping and the nicotine from vaping can actually harm your brain development. So right now you're doing so much growth. Our brains are developing until we're about 26 years old, which is pretty old. So when we're looking at that, we need to take good care of our brains. One thing, avoid vaping. Just don't start. When you start vaping, I do have some teens who want to stop, but they can't. They're really struggling with it because their body has become dependent on that nicotine every day. And they're having symptoms. If they try to stop, they're having symptoms of poor health if they stick with it. So what do? We talk about that. Talk to your healthcare provider if you're having problems with stopping a substance. It's really important, though, to not pick it up. And if you're struggling with it, stop it. The same thing goes with alcohol and drugs. So I'm assuming most of you guys are under 21, so these alcohol would be illegal. But reasons why I see teenagers start drinking alcohol. One thing is they're struggling with mental health problems. So there might be somebody in the family who drinks alcohol. They're seeing that family member use that as a coping strategy, and they get desensitized to it and start thinking, you know what, I'm feeling kind of bad. I'm feeling kind of down right now. I might start using that alcohol too. Maybe it might make me feel better. It is a very unhealthy coping strategy. Very, very, very unhealthy. So when we talk about mental health in a minute, we're going to talk about the difference between unhealthy coping strategies and healthy coping strategies. Vaping, smoking, drinking are some ways that people do respond to anxiety and depression. Those are unhealthy coping strategies. We can find much better tools, and they exist. You just got to look for them. You got to ask for help. Other things that are important is social media and sexting. So hopefully you guys have gotten some of this information through school. Talk to your parents about it, but it is very important to know that anything you put out there on the internet, you can never take back, ever. It is out there permanently. Somebody can find it. So things that are really impactful up here, maybe think about it when you're in high school, but I know that college admissions departments look at your social media. They find ways to track you down. And then as employers, they also look at your social media. So that's a big reason to just avoid it. Also, it's just distasteful. Do you need to put pictures of your beautiful unclothed body out into the world? No. you don't when you're young. So save that for somebody who's, when you're an adult who you're in a loving relationship with. But once you put it out there, you can't take it back. Also, having sexual intercourse and it being unprotected, that is very, very, very risky behavior. So as a healthcare provider, do I talk about my judgment on whether you have sexual intercourse or sexual activity or not? No, I don't. But I do talk about knowing your risks. So when we talk about sexual activity, the only way to avoid 100% pregnancy and STDs is to not have sex. So that's the number one way. Anything else we talk about is going to be at risk. It's going to have some element of risk depending upon what form of protection you use. So safest thing is to be abstinent until you're ready. So when you are considering if you're ready for sexual activity, my question that I ask you is, are you ready to deal with the potential consequences of an unplanned pregnancy or an STD? If you cannot say yes to that, then you're probably not ready for sexual activity. If you say, okay, I'm ready to talk to my healthcare provider about protecting myself against pregnancy or STDs, that is taking a very responsible approach to the subject. There are lots of options out there, and go talk to your healthcare provider about it. But not protecting yourself is incredibly risky. There are diseases that we can treat. There are diseases that we cannot treat. And I see both, and it is really devastating for some young adults to deal with. Pregnancy is the same. So talking about, I'll really quickly touch on earbuds, because I know you guys are doing this probably every day of your life now. So are earbuds bad? Earbuds themselves, no, are not bad. But any form of listening to music through headphones or earbuds has a risk, and it's all in the volume. So if you have a reasonable volume, it's turned down low, you keep it low to where, okay, I can hear it, but I'm not, it's not blaring into my ear, especially when we use those earbuds, we're sticking them in so tight, it's so close to our eardrum and those little bones that have to vibrate in order to hear. When we turn up the volume, day after day, week after week, we are potentially causing permanent hearing loss to our ears. So lower the volume. And that goes for, just because you have headphones, you can still have the same risk based on that volume. Also, if you're playing a stereo, blaring it up, turning the volume up loud, same risk. So lower the volume. Talking about mental health, this is something I talk about every day that I go into my office. It is become one of the most common things I talk about. I have young adults in all places and where they're dealing with stress and issues with anxiety and depression. If you are already struggling with this, you are not alone. It's very common, and it's becoming more common. The key is, how do you deal with it? If you recognize it, you're struggling, it's something that you're carrying with every day, all day long, please talk to somebody about getting some help. So first thing I talk about when I see somebody who is stressed out, is feeling like they're anxious, I do some questionnaires, and it really helps me break down, is it every day? Is it half the week? Is it maybe, 1 day a week? So that really makes a difference. When we're talking about, maybe it's a couple times a week, things that we can focus on are just a healthy lifestyle. Sleep is very, very important. So the more sleep we get, the better we will feel. There's no question. You need at least 8 hours every night. So look at when you go to bed and when you fall asleep, and when you need to wake up. From that wake up time, back it up at least 8 hours, and then try to get 10 if you can. So stick with a consistent bedtime. Avoid daytime napping. It interrupts your daytime sleep and will push back your bedtime. If you take a nap for longer than 20 minutes during the day, you get into a different kind of sleep when you sleep more than 20 minutes. So if you take a nap, make sure it's super short, like 5, 10, 15 minutes, even set your alarm. That's a power nap. But when you go past 20 minutes, you're going to get into a different sleep cycle. And then you'll notice midnight, 1 o'clock, maybe you can't fall asleep. It's that daytime nap. Our brains need about 12 hours of awake time to really be able to settle down and easily fall asleep at night. So try to avoid that daytime nap. Also exercise, laugh, have fun, talk to your friends, talk to your family, get outside, do things there, do it safely with COVID precautions, but find ways to laugh. I always tell people that laughing really does help your heart health. It improves your circulation. It helps your muscles relax, which actually can help lower your blood pressure. So there's a lot of studies out there that are really interesting that professionals who are very type A, who are very stressed out, who work long hours, who get little sleep, are at a higher risk for heart disease and heart attack just based on their lifestyle. So things that you can implement as a young adult is to incorporate having fun, laughing, relaxing, finding ways to disengage that are healthy from the everyday stressors that you might have. So if you're having anxiety and depression symptoms that are half the week or even every single day, that's when you really need to talk to your mental health provider, or I'm sorry, your probably primary care provider is a good place to start. So I oftentimes recommend counseling. Counseling is very easy and accessible these days. You can do it via Zoom. I do not consider medication like SSRIs, antidepressants, until I have a patient who is engaged in counseling, because you need to learn those healthy coping strategies to decrease your anxiety and depression symptoms. And like I talked about before, some unhealthy things are drugs, alcohol, vaping, smoking, hanging out with the wrong crowd, engaging in those activities, maybe looking for trying to feel better through sexual activity, versus healthy things can be music, exercise, journaling, reading a book, breathing tool. I do this with my kids all the time, or like a hot soup bowl, blow out the steam, ways to just kind of lower yourself, cap out from 10. And you also want to identify, what are your triggers for anxiety? Is it school? Is it COVID? Is it distance learning? Is it your family? Is it your friends? Is it your future? What are those things? And then that's when you want to talk to a professional about, how can I address those specific triggers for my anxiety to try to do it in a healthy way to decrease those symptoms on a daily basis. So that leads me to talk about the unfortunate thing of having thoughts about harming yourself, or even going to the extent of wanting to kill yourself, or teen suicide. Teen suicide is a real thing, and I am not scared to say that word, because I do talk to girls every week who think about harming themselves, or have even thought about killing themselves and having a plan. If you are having those thoughts, if you have those thoughts, you need to stop and reach out to somebody. So I know y'all are in different areas, but you can just Google Teen Suicide Hotline, and there's a national phone number that you can call and get somebody immediately to talk to and get you plugged in with somebody local. For my Sonoma County girls, I really recommend SAY, Social Advocates for Youth. Google them. They have a crisis line. They're excellent. They also offer group counseling, teen counseling. It's affordable, oftentimes free. They're a great resource for teen depression, anxiety, and thoughts of suicide. So if you have a friend who is having thoughts, do not walk away. Be there for them. Don't be afraid to reach out to your mom, your dad, your friend, get an adult's help to really say, I think we need to talk to this person. They're having thoughts or things that are really concerning to me. I have been in that position when I was young. I had a friend who I came across, I was 22, and I came across him at a party, and he was kind of to the side, and it's okay I tell this story because he wants me to, but he was kind of to the side of the group, and he was just sitting there crying. And I worked with this person, and I thought, oh my gosh, I just is not somebody I would imagine crying. So I drove him home, and I talked to him on the way home, and I thought, I could just walk away from the situation. I could think, okay, he's having a bad day, or he's probably okay. I'll let him deal with it. But there was something in my gut that was saying, no, that just didn't seem right. It didn't feel right. I know him. I've been around him. He's my friend. And so I reached out through the appropriate channels, through somebody who we worked with, and come to find out he actually had suicide ideation, which means he had a plan to harm himself. He was able to get help immediately, and he went into a program for 3 months, and he is a happy, healthy adult who I get a Christmas card from every year. And it really, it makes me proud of myself, because in that moment I could have walked away and said, I don't want to deal with this. I don't have time, but I reached out for my friend. So if you are struggling with thoughts of harming yourself, or you have a friend or loved one, please reach out. Unfortunately, right now with COVID, statistically, this is on the rise. Anxiety and depression is on the rise, and thoughts of harming oneself is on the rise. And we have to be brave. We have to seek out help for ourselves. I always tell my patients, thank you so much for being so brave and telling me that you're feeling this way, because I want to be here for you, and I want to walk this journey with you, and I want to get you some help to help you feel better, because I know that if you could wish yourself out of these feelings, you would. So, but it's all about reaching out. So some other things that can really help us in our healthy lifestyle is having healthy relationships. These are very important. And year to year, grade to grade, going into young adulthood, a workforce, you will have opportunities to meet different people in life. We choose our friends for different reasons based on where we're at in life. I have definitely in my childhood chosen friends that were probably not the best for me, and maybe I wasn't the best friend at times either. But my key is to choose like-minded friends. So if you are somebody who you know your values, okay, for me, I do not want to smoke in life. I do not want to vape. It's really important to me that as a teenager I did not choose that. So if I choose friends who are vaping, who are smoking, who are drinking alcohol, I am more likely to try those things and maybe become addicted to it over time, because I desensitize my brain to it. It's just commonplace. If I see my friends smoking or vaping every day, that's not that big of a deal. But if I choose friends who say, nah, it's not for me, I know that's bad and I don't need it, I'm pretty cool without it, which I think all of you are very cool without this kind of stuff, you choose those friends, stick with those friends who are like-minded. Same thing with sexual activity. If you're a girl who's hanging out with other girls who are freely giving their bodies to others, you are going to probably desensitize yourself to that thought, and you might engage in that behavior as well. So also the same things with romances. Whether you're in a relationship with a opposite gender or same-sex gender, you need to choose somebody who is good for you, who benefits you, who lifts you up, who makes you a better person. So my one thing when I talk to young adults who are in a serious relationship, my dad always told me this. He said, when you're in a relationship, you're not married, you're not engaged, but you're in a relationship, that's when it's as good as it's gonna get. If you are fighting, if you're arguing all the time, if you feel bad about yourself, if you are crying, if you feel shame, it's not a good relationship for you. There really isn't a good future for that, because trust me, when you partner with somebody for life, a lot of things happen. Job changes, job losses, fires, COVID, and you want to be with somebody who really lifts you up. So when you're young, you get to practice this. You get to, have relationships with different people to kind of try out what works. What type of person are you interested in? Do I like somebody who's smart, somebody who's loyal, someone who's trustworthy, somebody who's funny, somebody who's fun? What do I like? And that's what's great about being young, is you get this trial period. But if it's not a positive relationship, you need to be brave and walk away from it, and that's okay. Be good to yourself. You are the person that you really need to watch out for on a daily basis. So if something is hurting your heart, walk away from it. Healthy relationships are very important. Peer pressure, ooh, that's hard. I'm going to say peer pressure, I don't know anyone who hasn't felt peer pressure. My favorite thing about being an adult is it's much easier for me to say, nah, I don't need that. I like who I am without it. I don't need that. And honestly, unfortunately, even as an adult, I still am in situations where people are offering me substances that I don't want, that I don't want to partake in. But you know what? I believe in myself. I know what I value, and I like who I am. And I am confident to be able to say no. That is a hard thing to do when you're 14, 15, 16, and you're trying to figure out who you are. All I can say is do your best. Know what your values are. Be brave. When you go into a situation, listen to your gut. If something doesn't feel right, it probably isn't right. Have the courage to walk away. Also, as a female, I always encourage you to have a buddy wherever you go. If you go to a friend's house, if you go to a party, if you're in college and you go to an event, have a buddy, have somebody who you check in with. That actually increases your confidence too. Okay, I know this person's my friend. These other people aren't yet my friends. Maybe I don't want them to be my friends. I don't know yet. But if you have that buddy, you really increases your confidence, and it also keeps you safe. So that's going to lead me to my next part of safety. So an unfortunate part about sometimes being a girl and a woman is our vulnerability to being assaulted. And it is there, and it is a real risk, and it is not okay ever, ever to be assaulted. Know that piece of information first. So there are ways to avoid situations that you might be assaulted in. And I'm not saying I really believe against victim blaming. I have several family members who have been sexually assaulted and patients who have been. So this is a really, really important topic for me to talk about. So things that you can, just help you stay safe are avoiding those substances. When one thing about alcohol, drugs, is that they take away our inhibitions. They take away our judgment, our ability to think clearly, our ability to judge a situation that might be unsafe, because we don't care, honestly, when we are using substances. So don't use substances, especially in an environment that you are not familiar with, you are not comfortable with. Also have that buddy system. Go someplace with that buddy that you trust. Let your mom, dad know where you're going. It is completely appropriate to have a curfew, completely appropriate. I used to fight it. I never liked it. I thought my parents were trying to restrict me on having fun, but what they were doing is they were keeping me safe. They were making sure that I came home safely, that their beloved daughter was in her bed on time and was safe. And that's really important. So, when you're kind of in these years of testing boundaries, that's what teenagers do. Parents set boundaries, teenage test boundaries. You gotta trust that they are looking out for you. Call people on the way home, keep them posted about where you are, where you're going. These are very important things to kind of put into place along the way to keep you safe. Now, if you ever are unfortunately assaulted by somebody, you were touched inappropriately, this could be that you're kissed, that your chest is touched, your butt is touched, you are somebody puts their penis in your mouth, or makes you forcibly has intercourse with you. These are all things that are inappropriate. You own your body, nobody else. You own your body. So you have the right in every moment to say no. And I teach my kids are little, and I teach them, if somebody tells you stop, if you're kicking them, you're tickling them, and they say stop, they mean it, and you better listen. So, and it's true. So you speak up, say stop. Don't worry about what somebody thinks of you. If it makes you uncomfortable, get away, say stop, go get help. If you have been assaulted, please go seek help immediately. So I used to do exams on children and adolescents who had potentially been sexually assaulted. So this is something I did several years ago, and I actually am also a SANE nurse. It's a sexual assault nurse educator. So with this, I have been in the position where I have done what's called sexual assault kits or rape kits. And so what I tell my patients who've come in, thank you for coming to get this done, because if you ever are assaulted, there is evidence that is left behind, and it needs to be addressed and collected immediately. If you are assaulted, you do not want to go shower. You want to go get help immediately. The fastest way is through the emergency department. So all emergency departments have the ability to do this exam, and usually with a specialized nurse. And they're very skilled and trained in doing this. So you want to seek that help immediately. It doesn't mean that you are going to go prosecute somebody or go tell the police, or you actually really keep everything confidential, but it's very important to just go make that step, get examined, get evaluated, get treated if there's a potential for a disease, and have that evidence, because you never know what you want to do with that evidence. So that's something that later on you may just say, you know what, I don't want to do that, and that's your choice. Or you might say, you know what, I'm going to follow through with informing the authorities. So that's a big topic. There's a lot of information out there. I'm very thankful to see this Me Too movement, because women, I do feel like things are changing, and I do feel like women are getting their voice out there, that this is not okay. It's not okay. It's never okay to be touched appropriately or talked to inappropriately, especially in a workplace, a school. You need to speak up, be brave. Things to still kind of address: menstrual cycles. Oh my goodness, I talk about menstrual cycles all the time. So my quick take on menstrual cycles is that when you're in your teen years, there's something called, it's a feedback loop. It's your pituitary that's in your brain communicates with your ovaries, which communicate with your uterus, and then back up to your pituitary gland. And it's this loop that kind of occurs once a month, roughly. When you're in your teenage years, it's an immature loop. Your body hasn't quite figured out the appropriate way for things to communicate. So it's not uncommon to have irregular periods, or have very intense periods, or have heavy flow one month and light flow the next, because your hormones are kind of like a roller coaster right now. So it can be all over the place, especially for the first 2 years after you start that first period. After that, they should get into somewhat of a pattern of about a menstrual cycle every 21 days to every 45 days, 30 being the average. If you don't have it on 30 days, that's okay. There's a little bit before and a little bit after that are within our normal range. So if you are having a lot of cramping, a lot of discomfort with it, things to do are kind of conservative things at home, like maybe take ibuprofen and NSAID, nonsteroidal anti-inflammatory, Motrin, Midol, Aleve. Use a heating pad. Make sure you are getting lots of sleep. Make sure you're getting exercise. Make sure you're staying hydrated. Those are all things that really help. If you are experiencing these symptoms every single period, you are in bed, you are miserable, you can't go to school, you can't go to work, you can't hang out with your friends for days, I want you to come talk to your healthcare provider. So there are treatments that we can investigate and maybe set you up with if that is a problem. So some cramping is normal. Heavy flow can be normal. Irregular periods can be normal. When it's debilitating, go talk to your healthcare provider. PMS, premenstrual syndrome, is a real thing, and it stinks sometimes. Symptoms of that can include mood swings, fatigue, food cravings, irritability. I'm sure most of us have experienced those. When it can be a problem is when it's every single cycle for several days leading up to your cycle, and it interferes with your relationship with others. So I noticed before I'm getting ready to have my period, I'm hungry. Like, I want chocolate. I want junk food. I'm kind of emotional. Oh my gosh. But as soon as I have that drop in hormones, because basically that feedback loop, my pituitary gland told my ovary to make an egg, my ovary released that egg. I did not have intercourse, so I did not get pregnant. So that egg got flushed out, and then my uterus sheds that lining. And so when your uterus sheds that lining, it's cramping, it's getting rid of it. That's when those hormones are at its lowest, and that's usually when those symptoms go away. But like I said, if these symptoms are problematic, that's when you want to go talk to your healthcare provider about it. Let's talk about some cancers and things that women are specifically at risk for. So I mentioned the HPV vaccine. I am a believer in the HPV vaccine, especially now that there's a lot of good literature and studies that have come out, because this vaccine has been on the market for about 15 years now. So we can really see its positive impact on women's health. So your cervix, if you don't know this, you have your uterus, you have your cervix, there's a little hole in the middle, it's kind of like a donut, and the hole in the middle is called the os, and the os serves as a entry and exit way for things like cervical discharge and your period blood. And then also when you decide to become pregnant someday, that's also the entryway for sperm. So the os is a very important piece, and then the cervix is around it, and then your vaginal vault is on the other side, and then you have your vaginal opening. So with that cervix, you can have changes over time to the cells in that cervix, and the leading cause of changes in those cells is HPV. HPV stands for human papilloma virus. It is a virus that has lots of different strands, lots of different numbered strands, 9, 13. And the vaccine targets the 4 most common strands that lead to cervical cancer. So makes up about a 97% of cervical cancer cases. So why the vaccine is really important is because it's going to teach your body to make a memory of those strands of that HPV virus, so that someday, if you do come in contact with it through unprotected sex, also through oral sex, that's another way, because we can have that virus in the back of our throat. Your body's going to say, I know you, virus. I'm going to get rid of you, and you're never going to cause those changes to my cells. So therefore, I'm never going to get cervical cancer. So it is a great prevention strategy that's very effective. This vaccine is given in 2 doses if you are under the age of 15 when you start it. So if you're 11, 12, 13, 14, you will only get 2 doses 6 months apart. If you started at age 15 or later, you get 3 doses spread out over 6 months, and your healthcare provider can talk to you about the timing for those. But I really encourage them. I'm sure a lot of you have already gotten these vaccines already. One of the most common side effects that I do see with it is girls tend to faint in the office. They have a sore arm. They also have that vasovagal response. So they get the vaccine and they don't even realize they're holding their breath, and then they try to get up and then they pass out. So we have them sit on the table for at least 15 minutes. If they're feeling sick, feeling flush, feeling like they're going to throw up, we get a basin, we keep them a little bit longer. And then usually once they feel better, that kind of revved up sympathetic nervous system has calmed down, they feel fine. So like any vaccine, you can have soreness at the injection site. So, and I think I just saw somebody type in the name of this vaccine is called HPV, or Gardasil is the manufactured for most the vaccines that clinics will carry. So the HPV vaccine or Gardasil. So 2 other types of cancers that women are susceptible to, unfortunately. One is breast cancer. It is the 2nd most common cancer in women in the United States. Skin cancer is the number 1. And ovarian cancer is very concerning, and I'll talk about that after I talk about breast cancer. So there are some genetic tests that you can get done if you have a family history of breast cancer. They're looking specifically at the BRCA1 and 2 gene. So it's important to know your family history, your female family history. You want to talk to your mom, or if you are adopted, your birth mom, see if you can find any information about your maternal mom, your maternal grandmothers as well. And then also there's an impact of paternal side, so the dad line, on other types of cancers that can actually increase your risk of breast and ovarian cancer is colon cancer, pancreatic cancer. So you just kind of want to know your family health history, really not your distant cousin or your uncles as much. It is important, but really know when you go to your healthcare provider, especially when you enter adulthood, you want to know what type of cancers mom or dad have had, maternal and paternal grandparents. So if anyone had breast cancer under the age of 50 or any other type of cancer under the age of 50, you're going to go into a different category of risk. And that's important to know. So my mom had breast cancer. I also have colon cancer and ovarian cancer in my family. So I have already started getting mammograms every year. So I started that at 40, and I also do self breast exams. So when you're young and you're growing and you're developing and you're a teenager, breast cancer, thankfully, is very uncommon. When we do see it in younger women, there is usually a very strong family history of breast cancer. So that's why you need to know your risk. But I do talk a lot about how can we detect any changes in our breasts. So basically, first thing, you need to know what your breasts feel like. Not when you're 11, 12, or 13 and your breasts are really just forming, because they hurt. I remember, thinking, oh my gosh, something is wrong, because my breasts were developing and they really, those milk ducts were growing, there was inflammation and it hurt. So once you get past that stage, you're done developing, usually about age 15. You want to start knowing what your breasts feel like so that you know if there's a change, you already knew what your breast felt like. So I recommend once a month, you put your arm, and don't do this around your period, do it in the week following your period when you don't have those hormones in place, that higher estrogen and progesterone. You want to take one hand behind your head and you take two fingers and you're going to rotate in kind of a circular pattern like this around your nipple to that breast tissue. And so at the moment, I'm looking for what feels like little beads, and that's normal. So these little beads, and I'm feeling bone, and there can be some very normal kind of lumps, bumps that are small and they feel like little beads. But that helps you figure out if there's ever something that changes. And so some of the things that I do see in teenagers is fibroids. So I do see teenagers who all of a sudden, maybe 15, 16, 17, can have 1/4 of their breast tissue is all of a sudden very firm, hard. They're going to come talk to me about it. Thankfully, these are normal findings, and we follow up with ultrasound, but it starts really the conversation of, is there something wrong, and what do we need to do to follow up with it? So your job is to figure out, what do my breasts feel like so that I can see if there's a difference. I'm going to start doing monthly breast exams. I'm going to, as an adult, follow the guidance of my healthcare provider as to when I should start getting breast screens. So typically it's going to start at age 21 when you go get that annual pap smear. Some of you guys may already be seeing GYNs, and that's normal, especially if you are sexually active. You are going to be going if you have any issues with STDs or any concerning symptoms, or if you've wanted birth control. Those are reasons why you might go before age 21, but we do recommend that as late as 21, you start establishing care with somebody who can do a breast exam on you and also make sure that you're not having those changes to your cervix, and that's done through a pap smear, and it's not as bad as everybody says it is, but it's not fun. So with that, knowing your risk is really important. Knowing your family history, these are important conversations to start having with the adults in your life. Ovarian cancer, unfortunately, there is no test for it, but how you're going to really set yourself up for catching it early later in life is if you know your family history, know your risk factors. Also, another thing that is very helpful is protecting yourself when you do decide to become sexually active. So like I said, unprotected sex can lead to contraction of diseases, one of those things being HPV, which can lead to cervical cancer. Also, STDs that go untreated, like gonorrhea and chlamydia, can lead to something called PID, or pelvic inflammatory disease, and these can lead to very serious reproductive health problems, even fertility. So this is why, it's important to decrease that risky behavior. Abstinence is honestly the 100% way to not even have to worry about these things. But if you decide to become sexually active, you need to protect yourself. Talk to your healthcare provider about the most effective ways to do that, and that's going to be through your healthcare provider. The Rhythm method is not very helpful. Condom use is okay, but not great. Birth control is better. IUDs and also the Nexplanon, which is the rod that goes into your arm, are much more effective. But these are all done, like I said, through your healthcare provider. Last couple of things to talk about would be autoimmune diseases. We talked a little bit about lung cancer. So anything that you inhale, you smoke, that is a substance can lead to lung cancer. It is not only tobacco, cigarettes lead to lung cancer. When you are heating something up, smoking it in, inhaling it, you are creating those carcinogens. You are inhaling things that are bad for your lungs. Don't do it. Autoimmune diseases, things that can come up. 1 in 10 cases of death in women is from an autoimmune disease. And those things are diabetes, lupus, multiple sclerosis, and hepatitis. Thankfully, there are some vaccines for hepatitis A, B, and which I'm sure most of you are vaccinated against. And then C, there is not, but there are always great and better treatment out there for hepatitis C. So really just living a healthy lifestyle is very, very helpful for preventing autoimmune diseases. Getting enough sleep, getting exercise, getting those antioxidants into your body through nutrition. You want to have color on your plate. The more color, and I don't mean candy, I mean like vegetables and fruits, the more color you get, the more diverse food, that actually improves your gut flora. This is one of my favorite things to talk about. So I'm a big believer in probiotics. So before I had kids, my husband and I did medical mission work, and we lived in Africa for 4 months. And it was amazing. And I got to see the difference in diseases in a third world country versus what we deal with in the US. There was a measles outbreak in the village below me. I got to go in and vaccinate people against measles. And let me tell you, I was so thankful that I had been vaccinated against MMR, measles, mumps, and rubella as a child. And I'm really glad that that's mandatory in most states. But I also saw that they have less autoimmune diseases, which is very interesting to me. And one of those thought processes are that they have more diverse gut flora. So, a lot of their nutrition is very deficient, and they don't get some of the fortified things that we get, but they do have more exposure to farm-based food and bacteria and viruses that live in our dirt. And so they actually just have more diversity when you actually test, and this is from testing poop, but when you test poop, you can actually isolate how diverse the bacteria and fungus is in the gut. And that the more diverse it is, the healthier your overall body is, and that decreases your risk of autoimmune diseases. So in the US, I talk a lot to parents about kids that are on like the American diet, which is typically cheese, grilled cheeses, quesadillas, milk, everything that's like has no color to it. And not like these things are bad, they're fine, but they should just be that one portion of the plate, not the whole plate every meal. When you don't have diversity in your food, you're really not giving your body a lot of challenge. You're not giving your gut challenges. When we give our gut fiber and fruits and veggies and color and diversity of foods, and we eat different things different days, and we try different foods, we actually are increasing the microbes that are in our gut, which improves our health overall, which helps decrease our risk of autoimmune diseases. So I have an autoimmune disease. Interestingly enough, it runs in my family. So that's different. I've done everything I can to try to take care of myself as best as possible. My grandfather had Crohn's disease. I have 3 cousins with Crohn's disease, and I actually got gene testing done to see my risk for my kids, and I have the genetic marker for Crohn's disease. So this is an autoimmune disease that is in my gut. And there probably wasn't a great way for me to prevent it, but there are really great ways for me to take care of myself now. And one of those things is I take probiotics. So I try to have healthy nutrition where I just get variety of foods, and I don't have that Taco Bell diet anymore. I really now focus on color and veggies, and I definitely make mistakes, and I don't feel bad about it because it's life and everything should be in moderation. But I would say, 80-90% of my nutrition is really good, and 10% is, the things that are yummy and fun. So I think I'm coming to the end. Are there anything that I didn't touch on that Jennifer, you wanted me to speak about, or?
Thank you. We have a couple of questions. I've been taking notes, One of the questions, and I'm just going to go in order because they started right away when you started talking, was about how to reduce, I didn't even know there was a word for the fear of getting shot. So trypanophobia. And so they, one of the questions was, how do you reduce the fear of getting shots knowing that you have to go into the office and get these shots?
That is a great question. So vaccines are important. We do not want to hurt the patients through vaccines. I tell my little kids this all the time. Shots can be scary. There is some associated pain that goes along with it, but shots are very important. Everything in life is about risk benefit, and trust me, things like measles, meningitis, hepatitis, these are things that we don't want to get. So we have to take steps to mitigate our risk, and one of those things is through vaccines. So they are necessary. So in my practice, there's a couple MAs who give our vaccines who are awesome. So that's one thing. If you ever connect with somebody who did a good job, who really helped you calm your fears, call ahead. You can actually do this. You can call ahead and see if, Emily, I don't really give shots anymore, but if Emily's there, on what days to go get your flu vaccine or go get your Menveo vaccine for meningitis. You can call and see if they're there, and it's not a guarantee, but that's one person. So really, try to see if you connect with somebody about it. There's also a numbing spray that a lot of practices have. My practice has it. It's like a cold spray, and we spray it on kids' arms, and it just temporarily numbs their arms so they really don't feel it as much, and that's really helpful. Also, just anything that are distraction tools. We have some goggles that are what they call the virtual reality ones, where you can knock down bears. So that's a good technique. Also, if there's something that helps you calm down yourself, like a stuffed animal, your phone, music, you want to listen to music while you do it, take these things in. I am always open to whatever works for you that helps you calm down in life. Do that. The fear of vaccines, I promise you though, is much greater than the actual pain associated with the vaccine. There's one MA in my office who gives shots, and she's so amazing, and kids are freaking out and crying, and that's okay, because it's a real fear. I have a fear of snakes, so I freak out when I see a snake, and I can really relate to somebody feeling that same way towards shots. And I'll have a child for 10, 15, 20 minutes be scared. It's okay to be scared. It's okay to express that. It's okay to cry. It's okay to scream, yell. I hear crying every day. It doesn't bother me at all. But when she actually does the shot, 9 times out of 10, they say, "Oh my gosh, that's it?" So just try to remember that you need to work on those tools, like anything that stresses us out, to try to decrease our anxiety, and bring those tools in with you.
Okay, thank you. So the next 2 questions have to do with milk. One person said that they haven't had milk since they were 3 years old, and is that a problem for them? Is that going to be a problem as they get older? And does almond milk have calcium?
Okay, great question. So you're not alone. I haven't had milk since I was 6 years old because I was diagnosed with a dairy allergy then. But a lot of people don't have milk for different reasons. Maybe they don't like it, their parents didn't give it to them, they have almond or soy instead. Yes, other non-dairy products do have calcium in them. Some of them, though, are not as good as sources. So I encourage you, whatever you like, whatever you drink, do a little homework, look at the product and see how much calcium is in it. You can research it and compare it to vitamin D whole milk. So, and I actually don't encourage patients to drink whole milk after age 2 because it is an excessive source of fat. And we have fat in a lot of other areas of our diet, and we just don't need that additional fat in the milk. It's very helpful for toddlers for brain development. But so if you don't drink milk and you're concerned about it, maybe you don't even drink almond or soy or any other type of alternative, that's when I recommend that calcium and vitamin D supplement in either a chewable or a pill form, not in a gummy form. So if you're not getting it in your diet, that's when you say, okay, I know I should probably have dairy. I'm not. That's okay, but I need to find another way to supplement, and that's going to be through vitamins.
Perfect. Okay, so the next question has to do with pooping. Somebody said, what if I don't poop every day and in fact I poop once a week?
Okay, so if you poop once a week, then I'm going to tell you that you're constipated. So even if it doesn't hurt when it comes out, but signs of constipation really vary. So the goal is that we poop every day, at the most every other day. And that just means that our body, we're taking in food, we're digesting it, we're taking out the nutrients we need, and then we're making waste. Poop is waste. So we should get rid of that waste every day. So a lot of things happen with constipation, oftentimes in kids. They've had it for years. It maybe started when they were 6 months old and they first started, baby food. So it can be a lifelong problem. So this is something, if it's once a week, you can start with changing your nutrition, like increasing water and fiber in your diet. You can take a fiber supplement over the counter like FiberCon, and drink that. If that doesn't work, then if you talk to your parents or your healthcare provider about going the next step up and maybe doing something called Miralax. So a lot of times you need to just clean everything out because you're actually having this waste that's stacking up. If you stool infrequently, if it takes you a long time to go to the bathroom, you're in there for 20, 30 minutes, it hurts, you ever have blood when you wipe, your tummy hurts after you eat a lot, but you haven't pooped in a while, or you're pooping infrequently once a week, you are constipated, and then you want to look into what's the best treatment for that.
All right.
And try to change the pattern.
Perfect. The next question is, you were recommending meat as part of that healthy plate, and as far as the protein is concerned. And the question was, what if you have high cholesterol? What kind of protein should you be focusing on rather than red meat?
That's a really good question. I don't actually want you to eat a lot of red meat. So it can be a part of your diet, a part of your weekly meals, but it shouldn't be what you eat every day. So you want to get a variety of sources of protein. I have no problems if you're a vegetarian. You just need to make sure that you get alternative sources of protein. So things like tofu, also fish, chicken, eggs. It should be something different every day. It should be diverse. And I do recommend looking at lean meats if you are a meat eater. You really don't want to have a high fat content meat. So for me, I don't digest ground beef very well, or steak. So, if I do eat it, it's going to be a very lean meat, like a 93%. 7% fat. So that's something to talk about whoever does your grocery shopping, or when you guys start doing your grocery shopping for yourself, you want to try to find lean meat products. Absolutely.
And thank you. The next question is, why does Gen Z have more mental health issues than previous generations?
That's a great question. So if you ask me, my opinion is your access to social media. So when I grew up, I didn't have a cell phone until I was about 19 years old. And even at that, it had minimal capacity. It was huge. And then I had a flip phone. So, and I didn't grow up with a computer either. So I didn't have this access to what other teens were doing or celebrities were doing. I really think that social media has kind of changed your all's perspective on the world and what's real and what's false. And this is just one element of it, but I do find there's some really good studies out there that show that if you are struggling with anxiety and depression and you take your phone to bed with you and you're looking at your phone constantly in your bed before you go to bed, and maybe you're pushing your bedtime back up because you're getting that blue light, that stimulation, you have a higher rate of anxiety and depression if you take your phone to bed with you. I think that this generation is exposed to also news sources and readily available information that previous generations were not exposed to. And I think sometimes kids need to be kids. Like, you need to just hang out with your friends and go outside, and you need to put the phone down. I'm always very, very bothered when I walk into a patient room and I see a young adult sitting there just like this, and their mom or dad are sitting over there and they're like this. And we're not talking to each other. we need to talk more face to face. We need to have personal connections. And that is why COVID is making this whole thing worse, is because you're having even less personal connections on a daily basis. So find ways to connect with people safely with your masks on, with physical distancing. Talk to your family, even if they drive you crazy. But it is important to put the phone down and not get lost in it.
That's really, really good advice. The next question is, do I need to get tested for sexually transmitted diseases before becoming sexually active?
So no, if you've never been sexually active, no, you shouldn't have been exposed to a sexually transmitted disease like gonorrhea, chlamydia. Now, there are some other reasons in other generations where maybe somebody was exposed to hepatitis C or HIV, but it's less of a risk these days because of the safety protocols we have put in place with blood transfusions and blood products that are given. So, but if you have not ever been sexually active, then the answer would be no. It can take one time to be exposed to an STD, HPV, chlamydia, gonorrhea. And the unfortunate part of a lot of STDs is that you are what's called asymptomatic, especially boys are. They do not know when they actually have chlamydia or gonorrhea. They have zero symptoms of it. So they can spread it from one person to the next, to the next, to the next. So once you do become sexually active, you want to know what symptoms are abnormal and when to speak up about it, seek health care about it. There's lots of different great clinics around your area likely to get STD screening. And it can be as easy as peeing in a cup. So I don't want you to think that you're going to get a pap smear. I oftentimes can screen for chlamydia and gonorrhea just through a urine sample. So don't let the fear of getting a pap smear get in the way of you seeking treatment.
One of the things that I might have missed I don't think I heard you talk about was herpes, and herpes doesn't go away, right? It's forever.
Herpes never goes away. So there was some STDs I mentioned that are treatable, and some STDs are not treatable, and they are there forever. And one of those very unfortunate ones is herpes. So herpes is a virus, and there are what I call above the waist herpes, and that's HSV. Those are if you get like fever blisters or cold sores, you've probably been exposed to that virus sometime in your childhood or even your adult life, where somebody was shedding that virus, probably didn't know it, and kissed you. Even sometimes this happens from grandparents to grandkids or parents to kids when they're actually shedding that virus, but they don't have a lesion yet. They transfer that virus to you. It gets in your mucous membranes. Then that virus lives in your body forever. So another similar virus to that is like chickenpox. Once I've had chickenpox, my body, that virus lives dormant in my nerve cells. So the herpes simplex virus lives in your body. Now the same thing for the below the waist. So that would be genital herpes. And once you contract that, there is no way we can make it go away. Now we can treat it with something called acyclovir, which is an antiviral medication, and it will decrease the severity of the outbreak, but it in no way gets rid of the virus that will always live quietly in your body. And how it's presented is it's something called a Schenkauer. It's a lesion that's usually on the outside of your labia, and it is incredibly painful. And if you ever have that, you want to go in and get tested, and the healthcare provider will be able to help you with that.
Okay, so thank you. The next question, I think this is going to be the last question because we're going in almost at 5:40. So this is the last question we're going to ask today is, somebody wanted to know, they use an inhaler and they were concerned about bringing that into their lungs and if that could increase their chances of lung cancer.
So that's a great question, because I thought of that exact same thought when I mentioned that inhaling something into your lungs would be bad. So I'm really glad that you asked that, and I'm sorry that I didn't clarify that more so. So no, if you have been prescribed an inhaler, you need to take your inhaler, and it will help you not harm you. So I'm actually an asthmatic. I've had symptoms of asthma since I was 9. I take a daily inhaler. I take a preventative, and I take a rescue inhaler when I need it, like on smoky days like this in Santa Rosa. So the reason why we take inhalers is because we have inflammation in our lungs. Some of this is from genetics. It's from just our makeup. There's something that triggers that inflammation, like a cold, weather changes, smoke. And so we just, during those times of inflammation, we don't perfuse. We don't get air in and out as easily. It's kind of like trying to breathe through a straw. That's hard. So what our inhalers do, the most common one are what's called the rescue inhaler. They're the bronchodilators like albuterol, ProAir, Ventolin. Those open up the inflamed airways so you can get air in and out better. So they improve lung function and improve inflammation. And then you might take a preventative if you need it, which would be prescribed by your healthcare provider, like Qvar, Flovent, Advair. There's several others. Those decrease the inflammation that exists in your lungs over time. So I take one every day because I have chronic inflammation in my lungs from years and years of asthma. So I'm actually helping my lungs. I'm decreasing the inflammation, and I'm getting better air exchange so I can exercise better, I can breathe better, I can talk longer, and I'm really setting myself up for not having complications like COPD and needing oxygen later in life. Now, the opposite, so inhalers help when you have a diagnosed condition. Now, carcinogens that are inhaled, like vaping, smoking, tobacco, those increase inflammation. Those cause inflammation. Those cause cell changes. So they are the opposite of those inhalers that are necessary for somebody who has a chronic condition. Those substances will actually create the problem, and they're bad.
Perfect. Perfect. Thank you so much. This was absolutely incredible, and I can't believe you touched on all of those important topics in that period of time.
No.
Awesome. That was really great work. Ladies, thank you for joining us today. We are going to share this video with you so you can go back and watch it again if you would like. And if you could all join me in saying thank you to Miss Emily, I would appreciate it. Go ahead and take yourself off mute and say thank you. Okay.
Thank you.
Thanks so much.
You are the best.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks very much.
You are very, very welcome. I can't see your beautiful faces, but I know you're out there. Take care of yourself during this time. Be kind to yourself. Give yourself grace. Go easy on yourself. Nobody is enjoying this that I know. Hang in there. Reach out. Talk to friends. Make wise choices. And have fun.
Bye, ladies.
Bye.
Bye.